Medical Assistant Practice Test, 2026. Question 1. Of the following structures, which would be located in the mediastinum? A. Occipital lobe. B. Aorta. C. Left carotid artery. D. Pancreas. The correct answer is aorta. The mediastinum is the central area of the thoracic cavity. It includes the heart, trachea, esophagus, thymus, and other parts of the central chest. The aorta is the main artery of the circulatory system and starts at the top left ventricle of the heart. Question 2. The point at which an impulse is transmitted from one neuron to another is A. Nerve center. B. Synapse. C. Dendrite. D. Terminal plate. The correct answer is synapse. The synapse would be considered the point at which an impulse is transmitted from one neuron to another. This is a small gap that exists between the neurons. Question 3. Which of the following terms is spelled incorrectly? A. Bacterial. B. Bacteriology. C. Bactericidal. D. Bacterium. The correct answer is bacteriology. Bacteriology is spelled incorrectly. It should be bacteriology instead. Question 4. In a human, urine flows through the urinary system in which order? A. Bladder, urethra, kidney, urethral meatus, ureter. B. Bladder, kidney, ureter, urethra, urethral meatus. C. Kidney, ureter, bladder, urethra, urethral meatus. D. Urethra, bladder, ureter, kidney, urethral meatus. The correct answer is kidney, ureter, bladder, urethra, urethral meatus. In a human, the urine flows through the kidneys, ureter, bladder, urethra, and urethra meatus. Question 5. Which bone is found superior to the patella and inferior to the ischium? A. Calcaneus. B. Femur. C. Ulna. D. Tibia. The correct answer is femur. The femur is found superior to the patella and inferior to the ischium. Question 6. Which abdominal region lies just distal to the sternum? A. Epigastric. B. Umbilical. C. Lumbar. D. Hypogastric. The correct answer is epigastric. The abdominal region that is distal to the sternum would be the epigastric region. Question 7. Blood flows from the heart's right ventricle into the A. Left ventricle. B. Right atrium. C. Pulmonary artery. D. Pulmonary vein. The correct answer is pulmonary artery. The blood flows from the right ventricle of the heart to the pulmonary artery. Question 8. Which of the following terms is spelled correctly? A. Gastrointestinal. B. Gastrointestinal. C. Gastrointestinal. D. Gastrointestinal. The correct answer is gastrointestinal. The gastrointestinal tract consists of the mouth, esophagus, stomach, and then the intestines. Question 9. Gas exchange in the lungs occurs in one-celled air sacs called A. Alveoli. B. Bronchi. C. Capillaries. D. Pleurae. The correct answer is alveoli. The alveoli is a one-celled air sac in the lungs where the air exchange takes place. Question 10. If a patient has rhinorrhea as a symptom, this means which of the following? A. Mucus discharge from the nose. B. Excessive tearing from the eyes. C. Excessive drooling. D. Excessive fluid in the ear. The correct answer is mucus discharge from the nose. Rhino is a prefix used for anything to do with the nose, and rhea means flow or discharge. Rhinorrhea is when the mucus glands in the nose are producing more mucus than can be absorbed. Question 11. What is adipose tissue in the body? A. The outer layer of the skin. B. The whites of the eyes. C. The sac around the heart. D. The fatty tissue in the body. The correct answer is the fatty tissue in the body. The term adipose means where the fat cells are stored. Question 12. Which of the following would be indicated if a patient came in with arthralgia? A. Trouble swallowing. B. Joint pain. C. Inflammation to a sweat gland. D. A headache. The correct answer is joint pain. Artho means to do with a joint or articulation, and algia indicates pain. Question 13. Which of the following would be considered a part of the large intestine? A. Ileum. B. Transverse colon. C. Duodenum. D. Jejunum. The correct answer is transverse colon. The transverse colon is part of the large intestines, along with the ascending colon and descending colon. Question 14. Adipose tissue is made of A. Fat cells. B. Lymph nodes. C. Muscles. D. Skin. The correct answer is fat cells. A person's adipose tissue is made up of fat cells. These fat cells are referred to as adipocytes. Question 15. The prefix brady, as in bradycardia, means A. Fast beat, irregular. C. A slow. D. Without. The correct answer is slow. The prefix brady means slow. It is used in terms such as bradycardia, meaning an abnormally slow heart rate. Question 16. Of the following, which would a certified medical assistant typically be able to perform when assisting the physician in the exam room? A. Assist with minor procedures. B. Start and for therapy. C. Administer medications by the intravenous route. D. All of the above. The correct answer is assist with minor procedures. When a certified medical assistant is assisting a physician in an exam room, they typically assist with minor procedures. Question 17. When washing hands, the three most important factors include A. Antibacterial soap, length of time spent in hot water. B. Friction, soap and warm running water. C. Position of the hands, friction and water temperature. D. Length of time spent, type of soap, and running water. The correct answer is friction, soap and warm running water. Washing hands in a healthcare facility is considered the most important step in the prevention of spreading infections. Question 18. In a healthcare facility, which of the following agencies or organizations work to set the standards for the safety of the employees? A. OSHA. B. LNC. CMA. D. JCOH. The correct answer is OSHA. The organization that sets these standards is the Occupational Safety and Health Administration, OSHA. Question 19. When a clinic writes a statement which sets the level of care that is to be provided, it would be considered which of the following? A. Mission. B. Standard. C. Objective. D. Requirement. The correct answer is standard. When a clinic or other healthcare facility writes statements which states or sets the level of care that is to be provided, it would be considered standards or standards of care. Question 20. In order for the healthcare facility to comply with the Health Insurance Portability and Accountability Act, HIPAA, each patient is to be given which of the following? A. A list of the employees and their credentials. B. The staff's work schedule. C. Office policies. D. Patient rights and privacy practices. The correct answer is patient rights and privacy practices. According to HIPAA, each patient is to be given a statement of the privacy practices of the facility/clinic. Question 21. Typically, in an outpatient situation, which of the following is the main reason for the visit shown in the admission record sheet? A. The first listed diagnosis. B. The principal diagnosis. C. The secondary diagnosis. D. The primary symptom. The correct answer is the first listed diagnosis. Typically, in outpatient care, the reason for the visit is the diagnosis that is listed first in the admission record sheet. Question 22. Before making rounds, a medical assistant should be sure that they are carrying which of the following on their person? A. A pen. B. A syringe. C. A glucose meter. D. A change of clothes. The correct answer is a pen. When making rounds, a medical assistant should always carry a pen with them. Question 23. When would Korokov sounds be evaluated? A. Determining blood pressure. B. Counting respirations. C. Evaluating pulse. D. Performing ultrasonography. The correct answer is determining blood pressure. The Korokov sound is evaluated when determining the patient's blood pressure. Question 24. For a medical assistant, which aspect of an exam room practice precedes the other listed techniques? A. A treating. B. Listening. C. Problem solving. D. A procedure. The correct answer is listening. One of the most important things that you can do in the exam room is listen. Question 25. Which of the following is important for the medical assistant to do before and after contact with the patient? A. Or record their interaction. B. Ask the patient questions. C. Disinfect or wash your hands. D. File a claim with the insurance company. The correct answer is disinfect or wash your hands. You should always disinfect or wash your hands before contact and after contact with the patient. Question 26. If an infection is nosocomial, it means which of the following? A. Contracted within the hospital. B. Originates outside of the body. C. Contracted by touch. D. That originates from within our own body. The correct answer is contracted within the hospital. Nosocomial means that the infection was contracted while the patient was in the hospital. Question 27. When pathogenic organisms are killed or destroyed, it is called which of the following terms? A. Asepsis. B. A disinfection. C. Antisepsis. D. Cleaning. The correct answer is disinfection. Disinfection kills all of the pathogenic organisms. This process is typically done using chemicals to get the result desired. Question 28. If a patient is tested to determine the antibiotics that a pathogen is susceptible to, what type of test is being conducted? A. Sensitivity. B. Biopsy. C. Culture. D. A cytology. The correct answer is sensitivity. If the aim of testing is to determine if a pathogen is susceptible to an antibiotic, it would be considered a sensitivity test. Question 29. A female patient comes into the clinic presenting with pain in the abdomen. The doctor notes that this could be dysmenorrhea. Which of the following best describes this diagnosis? A. Painful menstruation. B. A fluid-filled sac on the ovary. C. A tear or split in the abdominal wall. D. Kidney stone. The correct answer is painful menstruation. Dys means difficulty or pain, meno means menses or menstruation, and rhea means discharge or flow. Question 30. A patient comes into your clinic and is having difficulty breathing unless they are in an upright position. Which of the following is the proper medical term for this condition? A. Amenarche. B. Lithiasis. C. Orthopnea. D. Gynecomastia. The correct answer is orthopnea. Ortho is a term that means straight or erect, and nea means respiration or breathing. Since the individual will have trouble breathing when lying down, he or she may typically sleep sitting in a chair. Question 31. If a man comes into the clinic and the doctor observes that he has gynecomastia, it would point to which of the following? A. Swollen glands in the neck. B. Overdevelopment of breast tissue. C. A blood clot in the leg. D. Kidney stones. The correct answer is overdevelopment of breast tissue. Gyne is used to describe anything female and mastia refers to the breast. This condition is specific to men in that there is an overdevelopment of the breast tissue. Question 32. Which of the following should a medical assistant do while the patient is explaining their symptoms? A. Make eye contact and listen. B. Avoid eye contact and listen. C. Prepare for the next patient. D. Multitask. The correct answer is make eye contact and listen. The most important thing a medical assistant can do when a patient is explaining symptoms is to make eye contact and listen. Question 33. If a paper medical record needs to be corrected, which of the following would be an acceptable way to make the correction? A. Erase the portion of note that needs to be corrected. B. Draw one line through the portion of the note that needs to be corrected and initial it. C. Use whiteout on the incorrect entry. D. Shred that page of the chart. The correct answer is draw one line through the portion of the note that needs to be corrected and initial it. If a correction is needed on a patient's paper chart, a single line needs to be made through the incorrect portion and then the person making the correction needs to date, time and initial it. Question 34. Making a note in one file that a paper is in another file is called A. cross-filing, B. indexing, C. conditioning, D. cross-reference. The correct answer is cross-reference. Making a note in one file that a paper is in another file is called cross-reference. Question 35. Which of the following abbreviations refer to intracranial pressure that might be seen documented in a patient's chart? A. FACE-B, FMLAC, CVP, D. ICP. The correct answer is ICP. Intracranial pressure is listed as ICP in medical terms. Question 36. Computer underscore 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 is considered the computer's physical equipment. A. Hardware, B. Boot, C. Software, D. Application. The correct answer is hardware. Hardware is considered a computer's physical equipment. Question 37. If a medical record is problem-oriented, POMR, this means that each medical condition is assigned which of the following? A. Letters, B. Numbers, C. Time, D. Date. The correct answer is numbers. If a medical record is a problem-oriented medical record, POMR, each condition is assigned a number for tracking purposes. Question 38. Which of the following would describe a medical record that is categorized by date and time? A. Alphabetical, B. Numerical, C. A chronological, D. Terminal digital. The correct answer is chronological. Chronological medical records are categorized by date and time. Question 39. Which of the following would EMR refer to? A. The emergency magnetic resonance, B. The emergency medical records, C. European medical research, D. Electronic medical records. The correct answer is electronic medical records. EMR stands for electronic medical records. Question 40. Word processing software may be used by a medical assistant to create which of the following? A. Super bills, B. A record of all patients and their addresses, C. Inventory of office supplies, D. Transcriptions. The correct answer is transcriptions. Word processing software can be used by a medical assistant to create transcriptions. Question 41. A cystoscope is most commonly used by a specialist in A. Endocrinology, B. Urology, C. Gynecology, D. Gastroenterology. The correct answer is urology. A cystoscope is most commonly used by a specialist in the field of urology. Question 42. Which of the following would be used to indicate someone has taken a file from the file cabinet? A. Patient chart, B. Outguide, C. Tickler file, D. A summary form. The correct answer is outguide. The outguide is used to indicate when a person takes a file from the file cabinet. Question 43. Before referring a patient to another facility, a medical assistant should be sure to verify the patient's A. address, B. income, C. insurance, D. transportation. The correct answer is insurance. A medical assistant would need to verify the patient's insurance before transferring the patient to another facility. Question 44. A client would not be billed in which of the following situations? A. Where workers' compensation covers the injury and care, B. Where the patient has Blue Cross, C. Where the patient has no insurance, D. Where there's an indemnity insurance plan. The correct answer is where workers' compensation covers the injury and care. If the client is being seen for a workers' compensation injury, then the patient would not receive a bill. Question 45. A underscore 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 must typically be paid by the patient at each visit when services are rendered at a doctor's office. A. Copay. B. A premium. C. Deductible. D. A fee schedule. The correct answer is copay. A copay is a fixed amount for health services set by a health insurance policy. It must typically be paid by the patient at each visit. Question 46. When billing for ambulatory care, it would indicate which of the following: A. Use of an ambulance emergency service. B. The assignment of benefits. C. Outpatient classification structure. D. Outpatient services provided. The correct answer is outpatient services provided. If a facility is billing for ambulatory care, it is for outpatient services that were provided. Question 47. If a patient has end-stage renal disease, which of the following acronyms would be used when coding? A. NSTREDB, ESRDC, end-stage RDD, ES renal disease. The correct answer is ESRD. End-stage renal disease would be listed as ESRD in medical coding. Question 48. A pregnant patient's medical chart states air 150 bpm. What does this indicate? A. The electronic health record. B. Embryonic hereditary range. C. Embryonic heart rate. D. A mother's heart rate. The correct answer is embryonic heart rate. AIR is the embryonic heart rate. This may also be known as the FHR or fetal heart rate. Question 49. Of the following, which would not be considered to be a part of effective communication? A. A message. B. A noise. C. A sender. D. A feedback. The correct answer is noise. Noise is not considered a part of communication. Question 50. Which of the following is the center of the brain that controls fear, aggression, and anxiety? A. Amygdala. B. Cortex. C. A thalamus. D. Hippocampus. The correct answer is amygdala. The amygdala is the center of the brain that controls reflexes and emotions such as anxiety, aggression, and fear. Question 51. Maslow's hierarchy of needs includes which of the following? A. A money. B. A direction. C. A self-loathing. D. A self-esteem. The correct answer is self-esteem. Esteem is considered to be one of the 5 levels of Maslow's hierarchy of needs. Question 52. If a patient acts extremely rude to a medical assistant because their insurance does not cover their visit to the clinic, it would be considered which of the following? A. Displacement. B. Denial. C. Compensation. D. A sublimation. The correct answer is displacement. Displacement is when a person transfers emotions about themselves or their situation onto an external substitute, like slamming a door when angry. Question 53. When a medical assistant is able to listen to a speaker's problem and understand the speaker's personal point of view, it is called A. Nonverbal communication. B. A critical listening. C. Appreciative listening. D. Empathetic listening. The correct answer is empathetic listening. Empathetic listening is when one is able to listen to a person's problems and see from the speaker's point of view. Question 54. When someone listens for particular things and blocks out what they do not want to hear, A. A full listening. B. Selective listening. C. False listening. D. Listening barrier. The correct answer is selective listening. Selective listening is when the listener blocks out the parts of the message that they do not want to hear. Question 55. Which cranial nerve is related to the sense of smell? A. Hypoglossal. B. Olfactory. C. A trochlear. D. A vagus. The correct answer is olfactory. The cranial nerve that is related to the sense of smell would be the olfactory nerve, which is cranial nerve 1 or CN1. Question 56. A medical procedure cannot be performed on a patient until the doctor obtains underscore 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 underscore. A. Confidentiality. B. Informed consent. C. Insurance authorization. D. A vital statistics. The correct answer is informed consent. An informed consent should be obtained prior to a medical procedure being performed by the physician. Question 57. A medical assistant is at a bar with her close friend and they get to talking about work. The medical assistant informs her friend that the friend's teacher was in the doctor's office getting checked out for kidney stones. This would be considered which of the following? A. A breach of confidentiality. B. Assault and battery. C. A professional malpractice. D. Slander and defamation. The correct answer is breach of confidentiality. According to HIPAA, the medical assistant is not allowed to discuss any patient with her friend, much less in a public setting. Question 58. Of the following, which would the HIPAA requirements apply to in a healthcare facility? A. A physician's. B. A nurse's. C. A certified nurse aides. D. All of the above. The correct answer is all of the above. HIPAA applies to physicians, nurses, and certified nurse aides, along with the other employees that work at the healthcare facility. Question 59. A 17-year-old woman who is married arrives at the emergency department of a hospital with an injured arm. Who must consent to any treatment since this patient is a minor? A. Spouse and minor. B. Parent. C. Patient. D. The parent and the patient. The correct answer is patient. If the 17-year-old woman is married, she would be considered emancipated. In this case, the patient would be able to give consent herself. Question 60. If a medical assistant touches a patient with the intention of harming them, it would be considered which of the following? A. Malpractice. B. Battery. C. Harassment. D. Assault. The correct answer is battery. Battery occurs when a person touches another person with the intentions of causing them harm. Question 61. If a clinic charges a patient's insurance for treatments that were not done, it would be considered which of the following? A. Malpractice. B. Fraud. C. Assault. D. Embezzlement. The correct answer is fraud. Charging patients' insurance companies for treatments and or procedures that were never performed would be considered fraud. Question 62. If a medical assistant is underscore 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 underscore, it means that the medical assistant performs her duties in compliance with the standards of her job description. A. Dependable. B. A negligent. C. Competent. D. A trustworthy. The correct answer is competent. If a medical assistant is competent, he or she would have the ability, knowledge, and skill to perform her duties successfully to the standards required. Question 63. When hiring a new employee, which of the following forms is needed when they are choosing tax exemptions? A. I-9B 1099. C. W-4D 1096. The correct answer is W-4. The W-4 form is used by the employer to make sure the right amount of federal income tax is withheld. Question 64. If a patient's bill has been unpaid for more than 90 days, which of the following would call the patient? A. Attorney. B. A medical assistant. C. Collection agency. D. A physician. The correct answer is collection agency. Once the patient's bill reaches 90 days or more overdue, it should be turned over to a collection agency to contact the patient. Question 65. If a medical assistant managing patient payments learns that a patient's check has been returned due to insufficient funds, what step should the medical assistant take first? A. Call the patient. B. Call the police. C. Notify the collection agency. D. Call the patient's employer. The correct answer is call the patient. If a clinic gets a check is returned for lack of funds, a medical assistant's first action should be to call the person that wrote the check. Question 66. What financial record in a clinic is typically the most active? A. Accounts payable. B. Employee payroll. C. Accounts receivable. D. Malpractice liability. The correct answer is accounts receivable. The accounts receivable records are typically the most active records in a clinic. This section covers what the patient owes and pays to the clinic. Question 67. Good team members underscore 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 underscore. A. Focus on their tasks and not on some lofty goal. B. Do not communicate with or interfere with others. C. Do their job well without helping others with theirs. D. Accept responsibility and accountability. The correct answer is accept responsibility and accountability. Good team members accept responsibility and accountability. Question 68. Once an employee is hired, within how many days does the employer have by federal law to have the I-9 form completed and verified? A. 30 business days. B. 14 business days. C. 3 business days. D. Within the first year. The correct answer is 3 business days. Once this is completed and verified with the proper identification, the employer must have them on file within 3 business days of hire. Question 69. When checking the identity of a patient, most healthcare facilities require that the patient present __ forms of identification. A. 3B, 1C, 0D, 2. The correct answer is 2. Most facilities require 2 forms of verification. Question 70. If an individual is going to be using a computer for long periods of time, they should do which of the following? A. Adjust the chair height and monitor to a comfortable position. B. Sit as long as you can without moving so you do not break concentration. C. About once an hour, stand and stretch. D. Both A and C. The correct answer is both A and C. You should always adjust the chair, and never sit for long periods of time while working on the computer. Question 71. A patient is always late for their scheduled appointments. The office manager spoke to the patient about the issue, but it has not changed the patient's behavior. Which of the following is an appropriate next step? A. Always schedule them at the end of the day. B. Charge them a late fee. C. Force them to find another doctor. D. Have a heart-to-heart talk with them about the situation. The correct answer is always schedule them at the end of the day. If a patient is perpetually late for appointments, the best course of action is to schedule their appointments at the end of the day. Question 72. What type of booking or scheduling is used if a medical assistant brings multiple patients into the office at the top an hour to see their healthcare professional and they are seen on a first-come, first-served basis? A. Double booking. B. Wave scheduling. C. Standard procedure. D. Time-specific scheduling. The correct answer is wave scheduling. Wave scheduling is a method where multiple patients are scheduled to see the doctor at the beginning of the hour instead of every 15 to 20 minutes. Question 73. Call screening in a medical office is important because it allows a medical assistant to do which of the following? A. Avoid taking walk-ins. B. Avoid patients that are not emergency. C. Make sure the patient is properly triaged. D. Avoid patients that have caused trouble. The correct answer is make sure the patient is properly triaged. This is important because it allows the medical assistant to properly triage the patients by priority. Question 74. As a medical assistant, when a patient calls to cancel an appointment, you should do which of the following? A. Have the doctor call them to reschedule the appointment. B. Inform them that their appointment cannot be rescheduled. C. Tell the patient the office is too busy to reschedule the appointment. D. Process the cancellation and talk to the patient about rescheduling. The correct answer is process the cancellation and talk to the patient about rescheduling. As a medical assistant, you should process the cancellation and speak with the patient about rescheduling. Question 75. Which of the following treats a patient that has diseases of the blood? A. Cardiologist. B. A pulmonologist. C. Podiatrist. D. A hematologist. The correct answer is hematologist. A hematologist treats patients that have diseases of the blood such as hemophilia, leukemia, or sickle cell disease. Question 76. Calcium, potassium, and sodium are all classified as A. androgens, B. electrolytes, C. estrogens, D. prostaglandins. The correct answer is electrolytes. Calcium, potassium, and sodium would be classified as electrolytes. Question 77. Which is the term for an abnormally low white blood cell count? A. Anemia, B. Leukemia, C. Leukocytosis, D. Leukopenia. The correct answer is leukopenia. The abnormal low white blood cell count would be considered leukopenia. Question 78. In the periodic table, K is the symbol for A. calcium, B. iodine, C. phosphorus, D. potassium. The correct answer is potassium. In the periodic table, K would be the symbol for potassium. Question 79. Which blood type would be considered the universal donor? A. B. O plus C. O D B. The correct answer is O. The universal donor blood type would be O-. This blood type can be administered to patients with other blood types if there is an emergency. Question 80. Underscore 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 is a protein in plasma which forms blood clots and stops excessive bleeding during tissue or vascular injury. A. Erythrocytes, B. leukocytes, C. Reagent, D. Fibrinogen. The correct answer is fibrinogen. Fibrinogen is a protein in blood plasma which causes blood clotting after tissue or vascular injury leads to bleeding. Question 81. A condition of insufficient blood clotting cells is referred to as A. thrombocytopenia, B. thrombophlebitis, C. erythrocytes, D. erythrocytosis. The correct answer is thrombocytopenia. Thrombocytopenia would be considered a condition as to where there is insufficient blood clotting of the cells. Question 82. Of the following, which would be considered the first step in treating a patient with a chemical burn of the skin? A. Wash with soap and water, B. Apply an antiseptic ointment, C. Apply ice, D. Flush area with water. The correct answer is flush area with water. Flushing the area with cool water should be the first step in the treatment of a patient with a chemical burn. Question 83. If a patient has severe burns over more than half of the body and the burning process has been stopped, which of the following should be the next step in their treatment? A. Starting 4 antibiotics, B. Applying antibacterial ointment, C. Administering high-flow oxygen, D. Wound debridement. The correct answer is administering high-flow oxygen. With severe burns, it is important that you start the patient on high-flow oxygen and raise the head to an appropriate height to decrease edema in the airway. Question 84. If a patient is admitted with a cut that is still bleeding, which of the following should be done first? A. Stitch wound, B. Apply antibiotic ointment, C. Get a tetanus shot, D. Stop the bleeding. The correct answer is stop the bleeding. In this instance, the proper first step would be to stop the bleeding. Typically, this is done by applying pressure. Question 85. If an elderly patient suddenly has an onset of confusion, with no previous disorders or symptoms, what would be the most likely explanation? A. Urinary tract infection, B. Dementia, C. Hypoglycemia, D. Alzheimer's. The correct answer is urinary tract infection. A urinary tract infection is considered to be the most common cause of confusion with elderly patients. Question 86. Which of the following symptoms would a patient exhibit that could be indicative of cerebral edema? A. Abdominal pain, B. itching, C. Seizures and coma, D. Normal vision. The correct answer is seizures and coma. Cerebral edema can occur from several different types of injuries. Some of the symptoms could include seizures and coma. Question 87. A paramedic informs the medical assistant that a patient has had a cardiac arrest. What does this mean? A. The irregular heartbeat. B. A blood flow interference to the heart. C. A variation in the rhythm of the heartbeat. D. A sudden stoppage of the heartbeat. The correct answer is sudden stoppage of the heartbeat. Cardiac arrest is when there is a sudden stoppage of the patient's heartbeat. Question 88. The pharmaceutical abbreviation QID means underscore 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 underscore. A. Every hour. B. Every day. C. 4 times a day. D. Every week. The correct answer is 4 times a day. The pharmaceutical abbreviation QID means 4 times a day. Question 89. If medication has been ordered by a physician to be taken PC, it should be given A. Before meals. B. At hours sleep. C. After meals. D. Every 4 hours. The correct answer is after meals. After meals would be PC. Question 90. The pharmaceutical abbreviation BID means underscore 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 underscore. A. Once a day. B. A twice a day. C. Once a week. D. Twice a week. The correct answer is twice a day. The pharmaceutical abbreviation BID means twice a day. Question 91. If medication of a patient or resident is indicated as PRN, it is given A. Once a day. B. When necessary. C. By mouth only. D. To discontinue use. The correct answer is when necessary. PRN means pro re nata, which is Latin for when necessary. Question 92. All of the following are narcotic or narcotic-like analgesics, except A. Ibuprofen. B. Hydrocodone/APAP. C. Oxycodone/acetaminophen. D. Tramadol. The correct answer is ibuprofen. Ibuprofen is a nonsteroidal anti-inflammatory. It is widely used and is not a narcotic or narcotic-like analgesic. Question 93. Which of the following classifications of medications would be helpful in treating the patient that is complaining of heartburn? A. Beta blockers. B. Antacids. C. Analgesics. D. Antibiotics. The correct answer is antacids. Antacids are used to help with the problem of heartburn. Question 94. If a patient is prescribed a diabetic agent such as metformin, which of the following reactions should the patient expect to experience? A. An increase in their blood glucose level. B. A decrease in their blood pressure. C. A decrease in their blood glucose level. D. A vomiting. The correct answer is A. Decrease in their blood glucose level. If the patient is administered a diabetic agent, they should experience a decrease in their serum blood glucose level. Question 95. Of the following, which medication would typically be ordered to help a patient to get rid of excess fluid in their lungs? A. Furosemide. B. Erythromycin. C. Digoxin. D. Carvedilol. The correct answer is furosemide. Examples of diuretics include furosemide, Lasix, bumetanide, Bumex, and acetazolamide, Diamox. Question 96. A patient is diagnosed with a blood clot in their left lower leg and is hospitalized. Which of the following would more than likely be prescribed for the patient per intravenous solution? A. Warfarin. B. Heparin. C. Enoxaparin. D. Furosemide. The correct answer is heparin. With this patient, the first treatment of choice would more than likely include an intravenous heparin infusion. Question 97. Which of the following would be considered a muscle relaxant that might be ordered for a patient with back pain? A. Oxycodone/acetaminophen. B. Hexachlorophene. C. Bismuth subsalicylate. D. Methacarbamol. The correct answer is methacarbamol. Some common types of these could include such medications as methacarbamol, Robaxin. Question 98. If the physician prescribes a low-fat diet for a patient, which of the following should they be able to eat? A. Whole milk. B. A chicken with skin attached. C. Cake with icing. D. A boneless, skinless chicken breast. The correct answer is boneless, skinless chicken breast. With this type of diet, the patient should not eat anything that is considered as saturated fat. Question 99. Of the following, which would be considered the correct percentage of nutrient intake by the Dietetic Association for a person's protein intake every 24 hours? A. Of 15%. B. Of 65%. C. 25%. D. None of the above. The correct answer is 15%. The Dietetic Association says that the nutrient intake of protein should be approximately 15%. Question 100. Of the following, which describes the body's ability to maintain its normal state? A. Anabolism. B. Catabolism. C. Metabolism. D. Homeostasis. The correct answer is homeostasis. The ability of the person's body to maintain its normal state would be considered homeostasis.